Edema occurs as a result of increase in the forces that tend to move the fluid from intravascular compartment into the interstitial spaces. This normal fluid exchange between the intravascular and interstitial compartment is regulated by the Starling forces. According to this, normal fluid balance is maintained by two opposing forces named as intravascular hydrostatic pressure and plasma osmotic pressure. This intravascular hydrostatic pressure forces the fluid to move from intravascular to the interstitial compartment, whereas plasma osmotic pressure encourages the retention of fluid into the blood vessel, that is the intravascular compartment. At the arterial end of the capillary circulation, the hydrostatic pressure is more than a plasma osmotic pressure, so that the fluid moves from the intravascular compartment to the interstitial spaces. While at the venous end of the capillary circulation, the plasma osmotic pressure overcomes the hydrostatic pressure, so that the fluid returns to the intravascular compartment from the interstitial space. For example, hydrostatic pressure at the arterial end of the capillary is 45 mm of mercury and osmotic pressure at the arterial end of the capillary is 30 mm of mercury. If you do the basic math, so in result, at the rate of 50 mm of mercury, the fluid flow from the intravascular compartment to the interstitial space. While if we look at the venous end of the capillary, the osmotic pressure is 30 mm of mercury and hydrostatic pressure is 15 mm of mercury. So in result, at the rate of 50 mm of mercury, the fluid returns to the intravascular compartment from the interstitial space. Since the fluid is entering into the interstitial space at the rate of 50 mm of mercury and leaving at the same rate of 50 mm of mercury, there will be continuous circulation of fluid and no collection of fluid happen into the interstitial space. Hence, no edema will occur. I hope you have understood this basic concept. However, there is always very minute amount of fluid remains into the interstitial space during this normal fluid exchange. But this minute amount of fluid is drained off by the lymphatic system. With this detailed understanding of normal fluid exchange that occur between the intravascular compartment and the interstitial space at the arterial and venous end of the circulation, let's discuss about the causes of edema.